A lot of South Africans have been confused around the rollout of a vaccine that's still on trial. To some people, that has suggested that, in fact, we're still behind on our vaccine acquisition plans, particularly, of course, given the pullback of the AstraZeneca vaccine.
Yes, I think that we need to evaluate whatever vaccine we bring into South Africa. We need to evaluate that it does work against our strain. So that's very important. So every component of a vaccine rollout should have some kind of research component to ensure that we're not throwing good money after bad, and that the vaccines work with our variants.
So we were all excited. There was a sigh of relief, as I said in my introduction last week, as we saw the first healthcare workers being injected. And yet, of course, even over this weekend, there was a mess at Steve Biko Academic Hospital. The Bada site wasn't opened over the weekend. Doctors were getting last-minute SMSs. Some people showed up who were not in the system. Even this, it seems, we're not getting right.
Well, with the rollout is 4.5 days old, and the execution of it is still being planned. Is still being planned out. We're still trying to iron out all our problems. So, of course, what happened by 9:00 yesterday, Steve Biko had 900 people waiting to be vaccinated, and we had tried to open up the sites to GPs over the weekend to try and get them vaccinated. There are 10,000 GPs in the country. They've largely been left out, and they fell through the cracks, and so we were looking for ways of quickly vaccinating them so that they would also be protected. And of course what happens is that people hear that GPs are allowed, and everyone starts to come to the site without appointments. And so some of the people who had appointments joined queues that were very long. In the end, we vaccinated 1,020 people at Steve Biko, which is phenomenal. We're only wanting our sites to vaccinate around 600 per day. The Baragona site was closed because the people who are running that actually are volunteers. And so we now have to find other ways of opening up the sites over the weekend, working with the group so that we could get more volunteers to help. So the Baragona site is a magnificent site, and everybody there working there, do work in other parts of the hospital and other parts of the primary healthcare. Yeah. So everybody has to be patient. It's only 4.5 days. We've done over 15,000 people. We want to hit our target of 40,000 by Wednesday afternoon, which I think is a wonderful success. And I think that we all have to understand that as things roll out, there will be challenges in some hospitals, and there will be people that are angry.
Yeah.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.